continuing the series of general physical examination, that is pickle. Next one, or the current topic, is about ICTERUS. So I for ICTERUS. First we will know what is the definition of that. So it is yellowish discoloration of skin and mucous membrane due to excess bilirubin in blood. So this is the definition of ICTERUS. Then what are the sites where we will observe for ICTERUS? We will examine clinically. So coming to the sites, commonest site which we will observe is bulbar conjunctiva. So ideally we have to take the patient towards the window side where there is a adequate daylight, and we have to retract upper eyelids and ask the patient to look downwards and observe for bulbar conjunctiva, and we can comment about the yellowish discoloration if it is present. Why do we choose bulbar conjunctiva commonly for ICTERUS? Because bilirubin has a very high affinity or tendency towards elastin or elastic tissues, and this bulbar conjunctiva is very rich in elastic tissues, elastin. Hence it is a common tendency of the raised bilirubin to go and accumulate in this part, that is bulbar conjunctiva. Next is, what are the other sites where we can observe ICTERUS? We can observe it under surface of tongue, then again soft palate. We can look at palms and soles, so palms and soles, or general skin, like general appearance of skin. These are some sites. Then we have to know what are the differentials for ICTERUS. That is, other than raised bilirubin in the blood, what other things will give rise to yellowish appearance of the parts which we have discussed? So we should not get confused these conditions as causing ICTERUS. So among them, commonly discussed one is carotenemia. Here the general appearance of skin might be yellowish, but sclera and mucous membrane are not involved. This is the clue to differentiate carotenemia from jaundice or ICTERUS. Sclera and mucous membrane are spared. Then you have to know the other condition, that is generalized xanthomatosis. Again, appearance of the skin, general skin might be yellowish, but sclera is not involved even in this condition. One more thing is muddy sclera. The exposed part of the sclera, because of the dirt, it might appear muddy, which should not be confused with ICTERUS. And this muddy conjunctiva or muddy sclera is a non-pathological condition. So these are some differentials which we have to keep in mind while dealing with ICTERUS. Then next thing which we have to know related to ICTERUS is the causes, which can be easily listed out if we consider clinical classification of jaundice. You might be knowing this, that is prehepatic, hepatocellular, and posthepatic. Here mainly comes the hemolytic anemia, and any hemolysis because of mismatched blood transfusion, etc. In hepatocellular, proper liver injuries because of hepatitis, which might be because of infections, drugs, toxins like alcohol, etc. Then in posthepatic, mainly we will deal with obstructive jaundice because of the structural lesions in the biliary tract. For example, any stones or mass or malignancy in that biliary tree, or because of some structural problems. It might lead to obstruction to the flow of bilirubin, leading to obstructive jaundice. So these causes we have to think and try to fix into the reasons of ICTERUS whenever we see ICTERUS in any patient during general physical examination. So this is about the eye, ICTERUS.